So as you guys know, I'm Alex Andrews. I'm the Director of Volunteer Engagement at 9Health Fair. And my co-presenter today is...
Oh, Edith Thompson.
She's our liaison coordinator and helps all the liaisons know what to do best to support our fair. So Edith is a guru. All right, I think you guys are aware about our 3 models, so I'm not going to spend a ton of time on these. Most of you are doing a brick and mortar model, so we have to be really cautious about the number of people you let inside your building in one given time. So I think we've explained that. There are 2 sites that are doing kind of a drive-through open bay model, and then we have 1 parking lot fair. You can see on the right-hand side, these are all the things that are the same across any fair. Doesn't matter which model you're running. You guys have all seen the approval criteria, so we won't go into that. That's new for these fairs. We didn't do those in the past. So for our returning 9Health Fair site leaders, you guys know that's not something we've done, but we have 3 brand new sites. You guys wouldn't know the difference. That approval criteria is different for us this year with everything going on with the pandemic. What's new, of course, we have new safety guidelines, we have security positions, we have sanitation positions, and that health screening, that's the screening part there. So the health screening must happen before your participants get into the fair. It is a requirement. We want to make sure they have not been in contact with anybody that have COVID, that they haven't had COVID themselves, and there's other questions on that list. So look at this screening protocol to make sure your screeners know exactly what they need to ask. That screener, just so while we're on that position, Edith may go into detail, we want them to wear a face mask and face shield just like your phlebotomist would. They're not going to have to touch your participants because we have touchless thermometers, but it's still, they could get slightly closer than some of your others. So we'd like them to wear the face shield. So there's that position. And then of course, most of our sites are focusing on blood draw. And a few sites are adding on ask a medical question, but very focused on doing the blood work. And this year in that blood work, we are adding the COVID-19 antibody testing. So if they register online, they'll see that as an option. If they come in person, our cashiers will have to write it in the walk-in registration form. So as you can see, online is our focus. That's what we're going to put on all of our marketing materials and the flyers that we give to you guys. We want to make sure that the public knows that's our preference. We want them to go online. Most of our sites are offering on-site registration. We do have 1 site that's opted not to do that, but we really need to, it's usually been 60% or above of our participants that do walk-in registration. So we're really trying to accommodate those folks because we do serve an older population and still being able to come and get their blood work done because they've been kind of frustrated during these times, not been able to do things because they're not used to having to do it. So we're trying to make that work still. Face masks are required for everybody. We will have 1 type of face mask that you guys can give out to your participants. And then your volunteers, if they show up without a face mask, we will have surgical masks for any of your medical or non-medical volunteers that show up without a face mask. Gloves are required for all your medical volunteers, so centrifuge, phlebotomists, first aid, those places. And then if you have ask a medical question, we're really asking that it's just a no-touch screening and that they just talk. But if that ask a medical question volunteer decides they need to take their blood pressure or listen to their heart, then we would ask that they put on gloves at that point. Disposable lab coats are available for the phlebotomists, and we will provide those. We also will provide protective eyewear with a face shield that's attached to the protective eyewear. If they have their own face shield as a medical person and they prefer to wear their face shield, that is totally fine. But they have to wear both the mask and the face shield because those particles can come out underneath the bottom of the face shield. So we're recommended by the CDC that they wear both. We are providing cleaning sprays to disinfect everything. It is a cleaning spray that is used in, like LabCorp uses this cleaning spray, and I can provide extra details if you guys are curious about what that cleaning spray or disinfectant is. But the sterilization of it is a little bit better than the off-the-shelf stuff that a regular consumer would buy in the store. We are going to provide more hand sanitizer than we typically do. Some of our fairs are running on longer hours in order to still accommodate, large numbers of people. As you guys all well know, that we can't see as many people in one given time. So those longer hours are going to help some of our sites accommodate their community and still see more people. And then at your exit, we do have bags to give out. Just to give you guys an update on that, some of our sponsors will have Aetna, United Healthcare. I'm trying to think of a few others. We're going to have 9 News and Quest, and of course 9Health will be on there. I think there may be 1 or 2 Safeway Albertsons, since they're doing our flu shots. They'll be on those bags, and there might be 1 or 2 others. We do have flyers going into the metro area ones for YMCA DPP. That's the Diabetes Prevention Program. So we'll have some flyers in there on that, some flyers from Aetna and United Healthcare, and also our 9Health Neighbors program. If you guys aren't aware, that is very focused on, people make a phone call and they can basically like ask a medical question. They can get their questions answered by a medical professional within 24 hours. So we'll have those 4 flyers, really only 3 if you're not a metro area fair, because we wouldn't put the YMCA DPP one in there for our ones outside the metro area. So I'm going to go to next slide. I'm trying to remember. Okay. Now, provided by us, by 9Health, you'll see that you're going to get a site grant, cashiering materials. So you'll work with one of our new staff members, Anne Zodro. She is going to help with the cashiering. The PPE, those are the different things that we already mentioned. The cleaning products I mentioned. We will give you 2 thermometers, the touchless thermometers, so you can use that throughout your fair. We will print all of these basic protocols for you. If you're adding on any no touch screenings, like ask a medical question, we have one site that's considering a stress management screening, you will print those other optional ones you've decided, but we'll do all the other protocols for you guys, so you don't have to worry about printing there. On-site registration forms, we will provide a packet of those. None of the on-site registration forms are actually going to have your site number on them, because we're anticipating lower numbers for walk-in. We're giving you blank forms. So I'm going to hold this up, and we can send this later. Edith and I are going to do a training on this later, but these are the stickers here. It's pretty hard to see, I'm sure. The stickers there, and I could show it at the end of the Q&A session. They're blank though. Normally they have your site number on them and a different participant number associated with each person. And now we have to write those in. So we will give you guys specific directions on how to fill out the walk-in participant forms. You can see a few more supplies in there that 9Health provides. It's the typical stuff that comes with your stations. So hand sanitizer and pens. A lot of the other stuff that would be added on for some of those screenings, obviously we're not worrying about, like vision has a big kit, and, breast exams or pap smears, they have so much more that come with them, and we're not having to worry about that this particular season. We are adding on our typical station signs you'll get again, plus our marketing team is working on signage about safety and different requirements. So like the health screening requirement that they have to do upon entry, your banner and date stickers. So for our couple of new sites, you guys will get 9Health for banners. And for every other site, we're sending you the number of date stickers that you told us to. So we have a few sites that have 2 banners, but most sites, they just go the 1. For our returning sites, you remember those big red razor flags? We would like you guys to use those at the entry of your fair. Just kind of tells your participants loud and clear where your entrance is. They're bright red and they look like a giant feather, sticking up and kind of wave in the air. For our brand new sites, we will provide you with a razor flag, so you don't need to worry about that. We will provide name tags. There's not much else we're gonna need to do around volunteers, just the name tags. If they want to be mailed a certificate, we could do that, but we're really trying to decrease touch points. So we're not worrying about the certificates at this point because it's just more exchanging between people. But we could mail them out, or we could send them a virtual copy of a volunteer certificate if they want those. Then the bags again, and then we have like our parking lot fair and a few other fairs that need pop-up tents. We have 3 available if they're needed for any reason. Quest is providing, as usual, the blood draw equipment and centrifuge machines. Many of you have expressed to us that your venues are not open, you know, during their typical business hours right now. So it's pretty hard for Quest to drop off and deliver those A boxes. As you guys know, they have needles in them, so they cannot be sent to someone's home. They have to be sent to a business. So our workaround is having Quest deliver to us, to 9Health Fair, and then we will deliver both to you at the same time. We will deliver 9Health Fair boxes and Quest boxes. Let your liaison know if you have questions around that, if you're concerned. And then I think this is the last one I'm going to present on, then Edith and I are going to switch it up. So what you guys will need to provide, sometimes there's a little bit on this that might change site per site, but these are the general things that you guys would provide. Tables, chairs, extra hand sanitizer, especially if you guys have those stations, you know, those big, huge, like standing movable stations for hand sanitizer. Those are great to have around your fair right now. Someone can just reach their hand under and use it and not have to grab a bottle of hand sanitizer. Painter's tape for hanging up signs or marking X's on the floor. We really want to ensure that people are 6 feet apart. So that's one of the things our sites are doing, are either using spray chalk on the ground, especially outside. And then inside, people are using painter's tape because it just comes on and off really clean. Snacks for your nourishment station and your volunteers. We want pre-packaged stuff this year, so we're not contaminating anything. And then of course, you guys need to help recruit volunteers and the cashiering materials. And as I mentioned, Anne, before, if you don't know what cashiering materials you guys need, your Anne will communicate directly with your cashier supervisor. So as site leader, you may not, just don't worry about the details. Make sure your cashier supervisor is in our fair management system, and Anne will contact them.
Okay. Well, as you can see, we have a number of new positions, and we've also tweaked some of the positions that we've had for a number of years. And I'm just going to go through this briefly. But what I think would be really valuable for you is to get into the volunteer system, okay? Then the ambassador protocol, a little change to that one is that ambassador is really going to have to be on the social distancing and the safety measures. So even from the get-go, from outside, you're going to need somebody outside just kind of monitoring that, making sure everybody's staying there 6 feet apart. And then, of course, we always need our ambassadors inside to, again, they'll be monitoring the social distancing, but then they're also going to need to help out, like manage the line at the blood draw area. So the usual jobs for the ambassadors, but the number one thing is they're really going to have to be mindful of the distancing and safety measures. Then we have another one, it's a relief protocol. And this will be, especially for those sites that are doing shifts, and we have several of you who are doing shifts. And so this person is going to need to make sure everything stays clean and restocked. So say, like at the phlebotomy area, if they run out of the cleaning spray and paper towels, that person's going to just kind of keep monitoring things, make sure everybody has what they need, and you know, all of your supplies you'll have in a central place or tucked away someplace that'll be easier for them to get to and restock. And they'll especially be important after a shift is over, in between those shifts. to make sure that everything gets cleaned up, especially if it's going to be in the phlebotomy area. And then the security protocol, that's probably going to be done by either Alex or I at whatever fair we're in, because we have a whole list of things that we're just going to go around and check and make sure everything's being done, everything's getting clean. Also, this, you all, if you have any problem with somebody out in line or, you know, questioning or anything, that's on us. You don't need to take care of that. You find one of us and we'll handle that situation, okay? You guys are doing enough without having to deal with maybe a participant who's tired and hungry and cranky. All right. And then the phlebotomy protocol, we have a whole lot more strict guidelines. We had Erin Garcia write this protocol for us, and she has taught phlebotomy, she's worked in phlebotomy, and then of course Stacy Brake, our medical staff person, she went through it all, and so there's some pretty strict guidelines, and that phlebotomy area is really going to have to be careful about keeping those tables at least 6 feet apart, because when people get up and get out from their chair and walk to the nourishment center or whatever, we just want to be really mindful of those that spacing. And again, we'll be keeping that area really, really clean. And the lab supervisor, if you can, send that to your lab supervisor so that person can review it, and also the centrifuge protocol. That'd be really helpful for them. Then there's the change participant flow, which Alex is going to go through in another slide. And it's also in our best practices. But it's a sample of a good flow for your fair. If you're especially if you're new, it'll help you kind of figure out where to put your online or have a table for people who walk in, although we're discouraging that. But check that out because it's very well done. Then we have our safety protocol. We just want to make sure everybody's wearing masks, that they have gloves on. And if a participant comes without a mask, we have some that were donated to us that we will give them. Nobody can come in without a mask on. And you know, you can ask your volunteers to bring their own mask, but if they forget it or need one, they'll be in the supplies. And so, yeah, that's participants and volunteers. And then lastly, that cleaning protocol, we'll be wiping down. I mean, everything's going to get wiped down periodically between participants. We just need to be very, very mindful of keeping everything sanitary and clean, not only for our participants, but our volunteers and for all of you as well. So then in the boxes down there, Alex put the new positions and the modified ones. So I just suggest you get into the volunteer system, you go to those protocols, you read through them, you get, refresh your memory for those who have done a fair before and see what changes have been made. And realize, have any thoughts about these protocols. If you think we missed anything, we've tried to follow all of the guidelines as best as we can, but we're lay people too. So next. Okay, here are your suggested volunteer numbers. And again, this is going to be whether you're, depending on how many hours you're running, and if you're doing shifts, it also will depend on how big your space is. But 2 to 4 health screeners outside, helping screen people to get in, and your volunteers, 2 to 8 volunteer ambassador volunteers, 2 to 4 sanitation, 1 to 2, safety and security. And it's probably going to be either Alex or I or another staff person. But I think right now it's either going to be Alex or I. We've kind of divvied you up and we want to be there for you. Online registration, you're going to need 3 to 6. Again, depending on shifts. On site, 1 to 2. Your form check person, 1 to 2. Cashiers, 2 to 3. And I don't remember if this is mentioned somewhere else, Alex, but we're not taking cash. It's checks and credit cards. That's it, no cash. So you need, basically you need 1 or 2 people to do your checks, your credit cards, and then a cashier supervisor. Phlebotomist, 8 to 20. Again, that's going to depend on how much room you have. Centrifuge, 2 to 4. Nourishment, 1 to 2. Your checkout person, people, 1 to 2. And then your relief volunteers, 2 to 4. And again, suggested, if you have longer fairs, you're going to want more people. We just have to be so mindful of how many people are in the building at a time. Okay, next. Okay, so Safeway Albertsons is again going to be a very generous sponsor for us, and they will be offering, providing us with pharmacists for in-person flu shots at the fair. That's if, as long as you have enough room, because they have to be at least 50 feet away from the entrance or where the actual health fair is. And that could be
about the typo there, just so everybody knows. That's supposed to say 50, not 5. I'm sorry. My bad.
That's okay. But these people are great. They have been a sponsor for a couple years now. They're all very personable. They all come from different Safeway Albertsons pharmacy stores. And they're just, they've been great to work with. They will bill the participant their insurance first. They'll take their insurance information. And if they don't have insurance, then it'll be free. And if you don't want to have them at your fair, if it doesn't work to have them at your fair, we will have vouchers that can be given out at the checkout station. So, or in the past, we've had enough vouchers that if a family member isn't at the fair and the participant knows their mother needs one or child or whatever, they'll give you an extra voucher for them. So it's just been a really great relationship for us to have with them. Any questions on that, or are we going to wait till the very end?
Oh, go ahead, you guys. If you do have questions on anything Edith just presented on, feel free to chime in.
I was going to ask, are we still doing the online kind of registration like we did last year for people that were coming in? I know that the labels were like different.
Yes. In fact, we're encouraging everybody to do online registration. That's what we would prefer. Mm-hmm. And with that being said, the little labels that we put on the tubes of blood, we are going to just give the lab supervisor that whole roll, and then she can distribute them to the phlebotomist as needed. So there'll be less touching. But yes, we will be doing online registration and scheduling.
Okay, thank you.
Yeah, that's the biggest change for you guys with online is what you said, the scheduling. That's totally not something we've ever dove into for our fairs. So online registration, we're not quite sure yet. We're still working with our developers, and Edith and I will communicate with you guys when we know what that report's going to look like so that you guys are ready and can be trained. And it's got to be at multiple places. So your health screener is going to want to see the schedule, because they don't want to let people in, like say someone comes an hour early. They would ask that person, we need you to wait until closer to your appointment. So the health screener would need it, your online registration tables would need it, and your phlebotomist would need it. And then of course, you as leadership volunteers, you probably want a copy as well. But like I said, our developers are still working out some details, so we're not exactly sure what it looks like yet. And then to decrease some of the touch points at online registration, something else that Edith and I and talked to some other leadership volunteers about decreasing those touch points. One of our suggestions is that instead of handing the participant back their participant form, so like they're going to sign it, you're going to witness it and write in the hours fasting, instead of handing it back to them, one of our suggestions is to create basically a table that's a halfway point for your phlebotomist and your online folks to come and meet and exchange those forms. So your participant never has to touch it again, which is nice because then we're just cutting out one of the potential touch points. So think about in your flow if there's a place where you can set up some tables with baskets. We're going to have your phlebotomist numbered in our scheduling application. So then the phlebotomist will be told, you're phlebotomist number 1 today, and they'll know, go to number 1 to find their next scheduled person, and they'll have the scheduling app. So that's one of our suggestions to help that. We know your online folks can't necessarily come every time all the way to the lab. So we thought maybe a halfway point would work well. And we'll let you know how it goes at our first fair.
This is Marianne. I have a really quick question.
Sure.
How many people per hour per, like when you're thinking of online registration, do you have a feel yet for if that's going to be like every 10 minutes, every 15, just so we can sort of get an idea of that?
Yeah, they are 10-minute blocks for each participant. So then, you know, for example, if you've got 10 phlebotomists, all of your phlebotomists will see up to 60 people in that given hour.
And so ultimately, it sounds like it will help with flow. So if sites have some of those walk-ins, we would just allow people in as space was available for walk-ins or people who show up early or people who show up late. It just essentially tries to keep the number of people all arriving at one time down, right?
Right, exactly. That's Marie, right? I know your voice.
Yeah, that's me.
Hi.
Hi.
One of the things I would add to that is we've had some really useful conversations, both Edith and I, with site leaders, and your thoughts around planning this and making sure that we can manage potential walk-ins, because it's a big unknown this year. We know that our normal split in the last 2 years has been 60% walk-in, 40% online registration. And we hope to flip that this year and, you know, even more, you know, make it 90% online, 10% walk-in. Like we've been saying, we just really want to push the online so we can control the numbers. So a couple of the suggestions have been that, you know, say you've got those 10 phlebotomists, right? In our scheduling application, we could actually, for you guys, only put 8 phlebotomists and leave 2 of them just to manage issues, you know, if issues come up where someone could not be drawn on the first time, and your walk-ins. So we just leave those 2 for overflow. We also wanted to suggest a potential for having a wait list of phlebotomists. So if you guys recruit 10 phlebotomists for the day, but yet you have more phlebotomists contact you and say, I want to help, then have 2 or 3 or 4 phlebotomists on call, and that you guys could, you know, ask for backup. Hey, we had a no-show, or someone had to leave early, or we are able to space out a separate station and we're going to add on an extra person for these walk-ins, and we can do it safely. So that's just 2 ideas that in our scheduling application, we can modify how many we're actually showing to the community when they register online. And then second is the waitlist idea. These are good questions, and we'll have hopefully more time at the end.
Alex, this is Sherry. So one question that I have about the flu shots. So we cannot do walk-ins at our site.
Right.
And so for flu shots, that is challenging because they don't register ahead of time. Is that correct?
That is correct. We
So-
don't have a registration process for flu shots.
So I think we've decided we won't do in-person flu shots, but can we get vouchers to give to people?
Yes.
Okay, great.
We will have them available for all of you. If you are offering in person, you're still going to find some of your participants are going, I'd rather just go to Safeway Albertsons. I don't want to do it here. So we'll be ready with vouchers, whether you're offering in-person flu shots or not. And we'll make sure to get you guys covered.
Great, thank you.
You're welcome.
And the other question is, in the past, we've been able to get vouchers for blood work.
I have a slide on that. So can we
Okay.
pause on that one?
Okay, sorry
Okay.
about that.
No, you guys are good. Yeah, we'll go into those in just a minute. So I know Edith and I have talked to you guys a lot about numbers of people. So these numbers include everybody, okay? They include the 9Health First staff, they include your volunteers, and they include your participants. So the guidance that we are giving you guys is that if you're having an in-person fair, it's $75 for indoor. And I know some of our fairs are more cautious than that even, right? And you want to go lower. So, and we respect that, we honor that. We just need to know that when we're setting up our scheduling application so that we can adhere to what you're comfortable in your space. And then for outdoor, we're recommending no more than 100 people at the event in one given time. So you really have to think about basically a 50-50 split. If you've got 30 volunteers, you can have no more than 30 participants at the same time, right? So we just have to keep that flow going where they're in and out relatively quick, which with so few screenings, it's possible, right? We can really do that. The screenings that are happening are really quick in and out. So as you can see on the other details on this slide, we went right in between what the state is recommending for us and what counties recommended for us, because we did go through some health department county approval for your sites. So the county approval was much higher. They told us 150, the two different county approvals that we got, 150 for indoor events and 250 for outdoor events. But the state recommendations on their calculator were closer to 50 people or less for the majority of the square footage that we knew you guys had. So we kind of tried to land right in between those, a little bit more on the cautious side. So that's how we came to those numbers. We just wanted you guys to understand. The state is recommending when you go and set up these events, go to your county health department first. So really, we've got some room here, right? Some wiggle room if we end up going slightly higher in the numbers. We'd really prefer not to, just because we want to keep your participants and volunteers and you guys safe so that we're really spaced out. Do you guys have any questions about this spacing? I know this is a big thing on people's minds and how we make sure people are spaced out and they're safe. So I'm going to give you guys time to ask your questions before I move on.
So is the 75 for in one room? Because we have a ballroom, but we also have a lobby area and rooms in the back. So I'm assuming is the 75 in the ballroom area and then additional, since it's not in close quarters and spread out throughout a big building.
Yeah, it should be total. And I know that's hard to think about. It's total. Yeah, so, but like I said, we have some wiggle room. So if you ended up going, up to 80 at some point or 85, we are still within county guidelines, right? Where we really get into trouble is if people are not spaced out that 6 feet or more. And Edith was saying this before, we really have to make sure the table spacing, whether it's your lab area or a registration area, is more than 6 feet apart, because when you have a walkthrough, right, if it was only 6 feet apart and someone walks in between those two tables, then they're potentially less than 6 feet apart when there's traffic, right, going through those tables. So that really ends up, having to space out like say like 10 feet between your tables, and it'll eat up your space quickly if we're really managing the space well and keeping people distant from each other. So yeah.
Can I piggyback on that question? This is Mary Ann.
Sure. Hi, Mary.
What if a family shows up with like 4 kids in tow because they don't have childcare? I mean, are we going to have recommendations that they come just them? Are we going to, you know where I'm going with that, right?
I
mean,
do,
if a whole bunch of families come,
And
that
normally,
could mess up everything.
yeah, normally our fall fairs they've been coined the family fairs, right? And these are where we do see more kids. Now, I want to say something before I get into what we can do if that happens. Edith can attest to this. The numbers of kids that come to health fairs has historically been very low, right? And Edith, I don't know if you want to say more about that, but we have never gotten big droves of kids. It's pretty rare. These days and age, it might be a little different though, right? With, parents having to be with their kids more and be their everything, their teacher, their daycare, all of that. So Edith, I don't know if you want to say more on the typical numbers of kids that show up at fairs.
Yeah, over the last few years, we just have had very few children come, but that's really something to be mindful of though. Because we would prefer they just don't bring their children. And I think Alex was going to touch on the different ways if that happens, what can be done.
Yeah, a couple of different suggestions. So if that family comes with 2 adults, they could split up, right? Or 2 adults or more, right? They could split up where an adult stays, in their vehicle or at least outside the fair area with the kids, where one adult goes through the process and then they flip flop. So that's one potential. And, if they were scheduled at the exact same time, we would just need to work with them, you know what I mean? And make sure that that person, that adult that might be missing their 10-minute slot still gets through, while they're waiting. So we can troubleshoot those kinds of things because these are really far few between. There doesn't happen very much. The other thing is if you have an extra ambassador that can just stand nearby and watch the kids, if there's just one adult with them, that's an option as well. If there's an ambassador that has the time and, or another volunteer, if it's not an ambassador. So those are the 2 potential solutions, but it's really, like Edith said, we want to encourage families to just the adults come. That's the hope. I will add on one more thing though. Our flu shots are actually for people 5 and older. So if you have family members that come and they want to request flu shot for their kids, we can give them a voucher and they can redeem it. So that's still an option for the kiddos. They just can't come inside and do it. Does that help?
Yes, absolutely. Thank you so much.
You're welcome. Okay, so here's the flow. And I know this is tiny, but this is in our resource library on the volunteer management system. We have an indoor sample flow and an outdoor sample flow. And you will see, I really want to point out the online registration side. They should be in and out of your fair. Now, if you're offering in-person flu shots, it would add 1 extra stop somewhere, right? But other than that, it is a really simple, quick, there may be a security person or an ambassador outside. They're going to get their health screening is number 2. They're going to go to the online registration table and give them their form. They'll never get the form back. That's our hope, because we want to cut out that touch point. They won't ever touch the stickers. Those are going to be right in the phlebotomy area. So then that person just hands off, they sign their form and they walk to the blood draw tables, go through the typical, spiel with the phlebotomist, and then they're out. At the exit, they decide if they want to grab a bag or not. At the exit, one of our recommendations real quick on the bags that we're going to give you guys. We recommend that we're going to have these in your supplies that you'll get roughly 2 weeks before your fair. That you guys pack those with any extra health partners that you've invited, your normal IECs. Those are interactive education centers. If you're a new site leader, don't worry about figuring that out right now. Edith and I can explain what an IEC is. But we've had all these other health partners come and they have a booth at your fair. If you want to invite them to mail you a packet of flyers and you want to add it to that bag, please feel free. We still want to partner with these organizations, but we recommend that you do that some, week plus in advance and get them set up on the table that you want to have them on so they don't have to be touched. The hope is that, if somebody that wasn't feeling well did help to pack those, they're sitting for days, right? Like it's been advised by medical folks that, the virus dies on a surface after a certain number of times. So if you can pack those bags with any extra flyers ahead of time, the better, your checkout volunteers don't even need to touch it. Just let the participant decide if they want to take it. Your checkout volunteer is just going to direct them to it and let them know if you'd like to take a bag, please do so. And that's it. Normally we did a survey there at checkout, no more survey. We are going to actually add to the bag a little QR code so that if your participants do want to take a survey for us and give us their feedback, they can just scan that QR code with their phone. And then if that doesn't work, your online registration people, we have their email, and then our system knows if we have a cell phone, we can follow up with them later. We're not going to worry about it at the fairs and ask for their survey feedback that way. So that's the online registration side of the flow, and you'll see the on-site registration side is roughly 7 steps. Again, if you have any other screenings like Ask a Medical or flu shot, that may be slightly different. But if you've just got blood draw, that's in and out in 7 steps. It is really possible if your fair numbers for walk-ins are so low and you're just not seeing them, that you may not even need to have form check, right? If it's so low that the cashier is just seeing a couple people an hour, the cashier can do both, right? If you really have a worry about adding in steps with touch points, that is a possibility for you guys. At the beginning, we would recommend that you have a form check person just in case the flow is up there and they need an extra set of hands that those forms are being filled out properly. Okay, any questions about this sample flow?
Alex, what is the barrier?
Oh, those are just, artificial barriers that we put in there that, if somebody has a wall or, chairs, a lot of times different barriers are put in, and you guys have probably seen it, Sherry, you've probably seen it as a longtime site leader where, you want someone to stop, right? Like stop here, don't move past me. So those were just kind of sample barriers to demonstrate where you
So we could use like tables for barrier. We don't need to rent like the big curtain thingy-majingies.
Exactly right. And even if you guys didn't want something physical, but maybe that's a place where you stick an ambassador just to make sure the ambassador's like, whoa, did you check there first? Did you finish at cashiering or online registration? So even if you didn't have something physical and you wanted to put an ambassador there, that would work. Okay, so this gets to the question you were asking, Sherry. So this talks about different discounts you guys can offer to your community members and your volunteers. And then for new site leaders, you're not really going to understand fully what a marketing authorization form is. And I don't even want you to have to deal with having to remember that right now. If it comes back into play for an in-person, like a walk-in registration person, as liaisons, Edith and I will train you when it comes into play again. Just know for returning sites, that marketing authorization form that we had inserted into your walk-in registration area, not having to deal with it this year. So it's just one form again, right? We had those 2 forms going where your form check had to check both and collect one of the marketing authorization forms. We're not even considering it. So it's again trying to cut out touch points that we had. The paper vouchers, I think, is what you asked about, Sherry. We're not giving them out. We don't want to create more touch points again. There's also all the printing costs for us and logistics for you guys to have to hand those out. Really what we want you to encourage you guys is that online registration. If you have a community member that needs a discount, give them that My First 9HF. If they needed more of a discount, please let Edith or I know, and we will communicate with our leadership team and the executive team and see if it's possible to give a totally free, typically those vouchers, just for people that don't know, that covers the basic blood chemistry. So it's normally $35. These 20% discount codes that I'm showing you guys here will give them 20% off of everything they purchased. So if they wanted to do multiple screenings, it's off of everything they purchase online. So that's the number one way we want you guys to give them discounts, is online. We don't want to do the paper vouchers this year. The next thing that can happen is that they verbally can tell the cashier, I'm a 9Health for volunteer, and the cashier can still give them the 20% discount in person. Cashiers were trained, I think, 2 years ago to start doing that. And the second thing that they can do is we were going to start this year, and it's displayed here, giving out these package passes. Now, your participants and volunteers will see these package pass discounts if they register online. So you won't even need to worry about your online folks. It's already integrated into our system. If they buy blood chemistry and A1C together, they automatically get $10 off. If they buy blood chemistry, A1C, and vitamin D, then they automatically get $20 off in online. If they come to a fair and do walk-in registration, the cashier can verbally tell them about it, and we will have a laminated version of this package pass to person to look at. But again, we don't want the exchange of paper. So we were going to have actual package passes in registration when our normal spring 2020 fairs were going to happen, and we've elected to not do that. So again, there's multiple ways people can get discounts, and if you guys have any concerns or questions about the discounts and not doing vouchers, please let Edith and I know. We still trying to take care of people at this time, but just do it without paper. Questions there?
I guess can you explain again the walk-in people getting the package pass? How is that going to happen?
So they won't be handed a paper, but we can have this information that you see on the right-hand side laminated for the cashier. These package passes are new to our 9Health Fair cashiers as well. So this is something that they haven't had to integrate before into their process. But Anne, that I've mentioned before, is going to work with our cashiers on this. They can still offer this, but just verbally. They show them a laminated version of this package pass you're seeing and say, here, if you purchase both blood chemistry and A1C, we can also have this at your form check station. So your form check folks can talk to them about the opportunity. So they can verbally just show it to them, they can show them the laminated copy and then verbally explain it. We just don't want the exchange of a paper slip. Does that make sense?
And so, that's done by the cashiers or by the form checker?
Yeah, so it can really be, however seems to work best for you guys. Our typical process at a normal fair, under normal circumstances, would be that these package passes would be handed out in your walk-in registration area. And you would have a volunteer just focused on letting your participants know, hey, you have an opportunity to get another discount this year. And they would be handing out these slips of paper. And then the participant, after they're done filling out their walk-in registration form, they would show the form check person, I've got this package pass, and then they would go on to the cashier, and the cashier would actually take this, because this is like money. This package pass is like a $10 coupon. So the cashier would fill out the bottom portion and keep it for their reconciliation. But we don't want to do that this year. We don't want all those paper exchange. So it's just the cashier that needs to make sure that they're logging it in their reconciliation that they gave someone $10 off because they purchased blood chemistry and A1C together. So it's really a lot of verbal work,
Okay,
and
thanks.
and then writing in the reconciliation for the cashier supervisor.
I have a question.
Sure.
the discounts. So the thank you volunteer discount is 20%. With that, they're not doing that this year, or they are?
Those are, yeah, the Thank You Ball 20, they can
Mhm.
use that code in online registration. And
Okay,
same
and
with
the
my
family and friend is also an online, the same thing?
correct.
Okay, so is that discount the same as $10.20, same as, or what's that? So what's the 9Health package pass? Just,
Yeah, this is actually a really good question. I am glad you asked this. So if they register online, they can actually stack their discounts. They can use both one of these discount codes, the Thank You Ball 20 or My First 9HF, and get the package discount. So that's if they register online, they can get both. If they come in person, it's one or the other. It's very complicated for our cashiers to stack them. It just is not something they've had to do. And the process with reconciliation has been really complicated. So again, another reason to encourage your folks to register online. They can use both when they go online and get both discounts.
wow, okay.
Good question. Okay, Edith, is this one still me?
Okay.
No, it's your turn.
I know some of you are not planning on using our volunteer system to have volunteers sign up at your fair. Let me back up here just a minute though. First of all, I think almost all of you have gotten your steps 1, 2, and 3 in, and the volunteer management system. We really, really appreciate that. And so when our website goes live the first week of September sometime, people are going to be able to see your fair, and they're going to be able to sign up online to register for your fair. Then the volunteer management system, that is where your volunteers can sign up. And that's also where you access the resource guide, all kinds of materials. There's just trainings in there. There's just a lot of good stuff in there. If you, some of the fairs are only going to use our volunteer system for certain positions. Like a couple of the fairs that have run previously, they're reaching out to all of their previous volunteers. And so they feel like they're going to be able to get those people without putting those positions on our website, and then people can go in there and sign up to volunteer for your fair. Just let Alex or I know if you want us to put your positions in our system, and we'll do it for you this year just because of everything that's going on. But so look at all those protocols, and if you're a returning fair, you don't feel like you need to use our system, that's absolutely fine. You can use your own spreadsheet. Just keep track of everybody. So then the morning of, you know who's going to go where. But if you want to use our system to recruit volunteers, we'll help you in any way to get that set up, and we'll get it done and get people signing up to volunteer for your fair. So just let us know. Let us know what positions you want us to do, how many, and then make sure that you check out all the different training videos and all the good stuff that we have put in our system for you to make your life a little bit easier. But remember, we're always available by phone call, by email, by text messaging, whatever works for you. Let us know what we can do for you. Okay, next. All right, our publicity people have set up some really great webinars for you to participate in to help you publicize your health fair. And so that'll be the 27th, which is later this week at 6:30. And then on September 17th at 6:30. they'll also be sending you and your publicity coordinator little what they call publicity nudges, which are just little samples or ideas of how you can reach out to your community. We also have a couple of publicity interns who are supporting us this year from universities, and they've got some great ideas. So what your team can do is use our flyer templates that Kristen, who's on this call, she has helped create. You can send out emails to your constituents, to all of your contacts. You can put it on a social media page if you have one, like if it's your town has one. Try to piggyback on that. And then you can reshare what 9Health posts on social media. If you're a social media fan, you want to make sure that you follow 9Health there, because they put a lot of Facebook Lives on there. They're very informative, very helpful. So if that's your thing, I know it's not everybody's, but if it's your thing, please join us on our 9Health Fair Facebook page. Okay, next. Yes, what is next? Finish your steps if you haven't done that. I think most of you have. And you'll see once your fair has been completed, you get an email from Alex that says, you're good to go. You've put everything in. Now we want you to go in there and put your screenings in. And basically for this year, it is super easy because you're gonna put in your phlebotomy, your centrifuge area, your first aid area, and if you're gonna do ask a medical question, get a referral. And then we need you to put in one station, that's it, just one station. So you'll see another, you'll see where you go into stations and just enter one, that's all we need. You don't need to do all of those. We want you to register for the publicity webinar, or if you have a publicity coordinator, you can pass that information on to them this Thursday, August 27th. We want you to reach out to your volunteers and reach out to Alex or I if you need any help in the volunteer management system. Participant registration is going to open up first week of September. So we hope people are going to start signing up for your health fair. You will receive a site grant 3 to 4 weeks before your fair. And that'll help defray some of the costs of your fair. And then you will get your supplies delivered 2 weeks before your fair. And you will be contacted to let you know when those supplies are going to come. So, so somebody can accept them wherever whatever address you put in your information for them to be delivered to, but you will receive a call to confirm everything, make sure it'll be good to go. Make sense? Questions?
One question,
Yeah,
the publicity webinars, are they both the same, or will they be different information?
I believe they're going to be different. Kristen, are you
Yeah, they're going to
there?
be, I am. They're going to be different. So this first one will really be about things that you need to start thinking about now, maybe some of those social media posts. And then the one that's in September will really be more about making sure we're doing those nudges kind of right up to the fair, what you should be thinking about 2-3 weeks before your fair. And the first one will be more of like big picture stuff to think about now. So we'll definitely make sure that it's applicable to where you are in your publicity stages.
Any other questions about publicity for Kristen? You'll probably be getting an invite to those publicity webinars, and that's who it will come from.
I do have a question. we're going to be recruiting some of our volunteers from Charlotte's and our Rotary Club. Are we allowed to maybe put the links onto our Rotary Club website for this?
Absolutely.
Yeah.
Yeah.
Yeah, and Edith and I can help you guys. So there's a way to get links directly for specific sites and then just to our whole volunteer management system. But I will caveat that with the positions links that are very specific to cashiering, to online registration, that whatnot. They do need to set up an account, so they won't be able to do anything. So it is best just to share the volunteer management system. And then Kristen and I have worked to create video trainings and PDFs. So if you are worried about them understanding how to properly register, that's in that resource library again, or, you know, Edith and I can send stuff directly to you guys to show you where those are saved.
All right. What about links so that people get onto our Facebook? They can actually, people can register for 9Health Care. Is that a link, something that we can hook up so that they can actually register to go to the health fair themselves?
Yeah, you guys could put in links directly to your 9Health Fair page for participants. We
Okay.
can work with you guys on that too. I do want to point out my second typo I found, just so you guys see in Anne's email address about cashiering, that at the end of her name in her actual email, it should be a W. I spelled it correctly, but then in the email, you can see I have an M instead of a W. So sorry, I tried. I always do my best editing after I send stuff out. Okay, you guys, do you have any more questions for myself or Edith or Kristen? All right, so you guys know how to get a hold of all of us. We are here for you. We got your back. Let us know if there's anything we can do to support you guys, or anything that, like Edith mentioned earlier, if you are seeing things as you look through these protocols or any of our materials, and you have questions or concerns or suggestions for us, please let us know. We are all ears. We are new to this too. Right now, it's a totally new ball game, so we want to learn together.
Thank you all for participating.
Thank you.
Thank you for your time.
Thank
Yeah.
you.
Bye, you guys. Have a good one.
Okay.
Take care.
Bye.
You too. Bye-bye.